So today we welcome Fiona Stimson, Fiona, you are an NLP Awards finalist in the healthcare category. And reading the nominations that have been put forward for you, I'm strongly guessing that one of the main reasons you've been nominated is because of the work that you do at the Royal Marsden. And I believe you're actually at the Royal Marsden today. So could you tell us a bit more about the work that you're doing, bringing NLP to the Royal Marsden and other places?
Yeah, so thank you, Karen, for today. I really appreciate your time. Yeah, so at the Royal Marsden, I actually run a transformational research centre for Marsden. So it's quite scientifically based work. And as part of that, I also am a professional coach, and I coach many of the staff here. So NLP it forms the basis of my practice. You know, it's something that I have developed and grown by utilising the skills that it offers. So I focus on health and well-being with the staff, and helping them with performance coaching to improve, you know, how they're able to operate in their everyday work.
Which is something that I'm sure is really needed in that particular field. And also, you also do work with patients, don't you? From the work that you're doing, maybe through the Royal Marsden and elsewhere, supporting patients. So how does that pan out?
So with patients at the moment, we are the coaching with patients is done on a voluntary basis at the moment, and I actually do that at privately and through a voluntary work at the Fountain Centre within the Royal Surrey County Hospital. So I have, you know, patients assigned to me, and that can be at any stage of their journey. So they could be newly diagnosed, they could be going through, you know, undergoing their actual treatment at the time, and I also work with people post survivorship. So they want to move on, and that might entail returning to work. What does that look like for them? Often they don't know what they want. So we look at how to creatively, you know, look at who they are now, really focusing on, all of my work really focuses on being present, what is important now in this situation that you find yourself in. And working through that with them. So in terms of the patients, we do a lot of work on that, and I know that when David has obviously put in my nomination that we're doing a PhD study at the Fountain Centre with regard to coaching in patients in cancer, to try and define, so we can actually define some standards. We want this to be professionally done. We want this to be like the gold standard in this specialist area of work. And so we've actually started that study this year.
Brilliant. Yes, that's what David has written in your nomination. Fiona is bringing awareness to the effectiveness of NLP coaching within this specialist area, which you've just alluded to. And I think what is also beautiful is that he's written, Fiona creates a safe space, supports her clients at their most vulnerable, helping them to overcome fears, build their resources, manage and take control of their situation, finding courage in life-altering circumstances. And I believe that her dedication and commitment to this makes her very special. Which, I mean, how does that make you feel?
It's emotional, isn't it, when you hear those words played back to you? You know, that's just so special, and you know, he's such a lovely person. Yeah, that's I need to manage myself here. That does really, that's lovely, isn't it? And it's nice to hear. And you know, my clients, they feed back such positive, wonderful things about how their lives have changed. And I think that's why I feel so passionate about it. I really want this to become mainstream for our patients in this country and abroad. You know, I'd like to see this go as wide as it can go, and the possibility being endless on it, because I've seen, you know, daily I see the difference that it makes. I always say NLP is the difference that makes the difference in this, you know, in many situations.
Absolutely. And the key thing is with something like this, just to be very, very clear, you are supporting cancer patients to manage their situation more effectively for them, and make it as easy as managing cancer can be. But it's about the management, it's about the emotional management of themselves and that sort of thing. It's not about, oh, we've just suddenly found the cure for cancer or anything like that. It's not about that. It's about helping, supporting patients with the life-changing circumstances that they're going through.
Absolutely. You know, it's a lot, you know, they describe it as their world just falling apart. You know, they don't know what to do for the best. They feel that everything has been taken out of their control. And a lot of it is they don't understand what's going on for them at that time. They don't understand about the cancer itself. They don't understand about the treatments.
They
don't know what's going to happen, and it's that fear of the uncertainty that then drives that response, the emotional response.
I've got a breast cancer patient who's written, my friend recommended Fiona to me shortly after my diagnosis with breast cancer. I had just had surgery and we didn't yet know the extent of my illness. My life was unrecognisable from what it had been only weeks earlier. Everything had stopped. I was literally petrified of everything that was happening to me and of where it was all going to end up. I just crumbled. Somehow Fiona managed to bring me back bit by bit. And it goes on, and that's just, you know, my own stage.
It is an emotional field to work in, and you know, and that's one of my biggest learnings and, you know, challenges as well, to be able to manage myself in those moments with my client. Very important as a professional to be able to do that, isn't it?
Absolutely.
But holding that space for them, so they really want to be heard. You know, they feel that they're not listened to, or they don't feel they can talk to other people. They don't feel they can talk to those close to them because they feel guilty that it'll put another thing onto them. And so it's really gives them that time and space to actually just say it like it is. Just say how you feel. It's okay just to feel what you're feeling. It doesn't have to be positive. It doesn't have to be anything. Just say what it is.
And that's an empowering message for NLP per se, isn't it? You know, that's almost what, well, I believe that's one of the things that NLP brings us, is sort of self-empowerment.
Yes.
And that it is, as you say, the difference that makes the difference.
Yeah.
So what does it mean to you to be nominated for this award?
Oh, I will never forget the day. I was shocked, and I'm absolutely proud and humbled to be able to have been nominated. You know, never mind being in the final three. It's fantastic, and the difference that it's going to make, I think, to this specialist area, you know, is bringing that awareness that this is a thing that's in existence. You know, we are doing this, and we want to make it. We want to make it a professional service in terms of having those professional set standards and guidelines and ethics, everything associated with it, so that it's a recognised, integrated thing that happens as part of a person's natural pathway. So you're integrating that service with their actual treatments or whatever they've chosen to have, you know, to help them. And so to be nominated for this award will help to bring awareness to that.
Fantastic.
And can let people know that this is available. And what I would like is it for it to be available to everyone.
Oh gosh, absolutely. And wouldn't everybody, you know, that, I mean, anything that supports that particular area within healthcare, but also that particular area, because it impacts, you know, sadly, something like cancer impacts on so many people, directly or indirectly, in the UK and, as you say, globally. So anything that can support that is just inspirational, honestly.
It does. And it's so impactful per se, isn't it? Because if you look at, it's not just in illness. So I'm looking at people who are in relatively good health as well.
Yeah.
And how I was saying sickness and in health,
yeah,
we look at ourselves, you know, we know that we're in charge of what we're thinking, you know, and what we can do about that, and we can control our thoughts and, you know, how we are acting.
Yeah, yeah.
And if you are out of balance, don't necessarily have to be sick at that point to, if you're out of balance, it's about recognizing that you're out of balance.
Yeah.
And so this award will also bring awareness to that.
Yeah.
So if you notice what's going on for you, notice what your body might be trying to tell you, notice the little subtleties, the little changes in yourself, and act on it.
Yeah. Yeah.
You know, I found myself in a recent, you know, my father has recently been diagnosed with metastatic prostate cancer.
Oh no, I'm so sorry.
And we've been having very in-depth conversations about this and how he ignored those little subtle changes, you know, and ignoring has an impact.
Yeah, yeah. Well, you say
so
that.
Bring awareness to that.
Yeah, my father died of cancer 30 odd years ago now, aged 59. He'd done exactly the same. He'd ignored various signs, various symptoms that I mean, who knows what would have changed, what might have been different, you know, one will never know. And one of many examples of someone taken too soon. And there are so many examples of people who are taken too soon because of cancer. So you know, I applaud and am inspired by the work that you're doing in this field. So who inspired you to begin your NLP journey, or through your NLP journey? Who's inspired you?
So I started on my NLP journey with the Coaching Academy.
Oh yeah.
And Sarah Urquhart, she is a very inspiring lady. So she started me on the journey, and you know, at that time I was thinking, what is this all about? When you start off, what is this all about? And I was intrigued and very curious about it. So that, and you know, I just wanted to develop it more and more and more.
Yeah.
I think it really piqued my interest at that point when I did my practitioner.
Yeah.
And then you know, I've obviously been inspired by, you know, the work of Robert Dilts and others. There's so many greats, and interested in, you know, looking at their work and what they've been doing. So yeah, sorry, my screen has just gone off. Sorry. Oh. Let me just get it back. Yeah, so my practitioner level, you know, I think it was, you know, I was really still in the learning and development of that, the stages there. And then I loved it so much, I went on to do my master's, and that really gave me that, I think it was a full body experience of the deep inner work, which, you know, I find inspiring, that you can actually, you know, the work is all within you. It's all about personal responsibility, and actually then developing and growing that, and so that's how I've developed, you know, my interest in this area, and I'm taking it further and further and further, and I'm always reading about it. I'm always doing CPD. I'm so interested in how other people are developing and modeling the different approaches, using, you know, the foundations to actually create something that benefits others. And I think, you know, that's the whole thing about ANLP as well, and that sense of community.
Well, yes, that's brilliant. And that's our intention, is to have that sense of community. So yeah, thank you.
So that learning and the ongoing learning and research and development as well.
Yeah.
And I'd like to become more involved in that myself, do more research in terms of the NLP side of things.
Wonderful, wonderful. And there's always room for that, definitely.
Yeah.
Especially in your field.
Yes, definitely.
Absolutely. So where would you like to see NLP in the future?
Where would I like to see NLP in the future? In terms of my work?
In terms of however you would like to interpret that question.
I mean, I would love to see more NLP throughout the healthcare system. I'd like to see the tools and techniques firmly embedded within, not purely for coaches, for the medical staff themselves.
Yeah.
There is a great interest now within the medical teams for coaching and NLP, and to help them balance on a daily basis, to help them manage their patients' outcomes. So for me, that would be an absolute dream, to be able to see that happen in a shorter time, a short time scale.
Yeah, absolutely.
Because I can really see the benefits in the work that I've already done. So to have that more widely spread, and spread across the UK, the globe, it would be amazing.
Definitely. I remember we NLP answered some health consultation questionnaire a few years ago, about the use of what I think they called alternative practitioners within the health service, and that was very interesting. At least I thought, well, at least they're open to it, and I thought, well, I'm going to answer this a bit more honestly than they may wish. In terms of being more open to it, and it's really good that there are pockets.
There are definitely
pockets of development within public sector services altogether, where it's starting to be a bit. They're starting to be a bit more open to it, so that's wonderful, and that's all supported and driven by people like you, who are, at the front end, making a difference. I think you are the difference that's making a difference. To everyone that you are touching, your clients, the staff at the Royal Marsden, and it's just amazing and so humbling for me to talk to you and hear about the fantastic work that you are doing. So I want to say thank you on behalf of ANLP. I can't speak on behalf of, but on behalf of ANLP, the work you are doing, driving things forward within the sector where it's making such a huge difference. Thank you so much for the work you're doing. Thank you.
Oh, thank you, Karen.